I resonate with the people, and I know what it feels like when a family member gets sick.
On August 6, 2025, history was made at the Harbour Club as Orbital Wells officially launched, marking a groundbreaking step towards universal healthcare coverage for Saint Lucia and the wider Caribbean. From connecting patients to Joint Commission International accredited hospitals in India to offering affordable world-class treatment in specialities such as oncology, cardiology, fertility, orthopedics, neurology, and more. Orbital Wells is bridging the gap between local healthcare needs and global medical solutions. This milestone means that St. Lucians now have direct, transparent, and safe access to advanced medical care abroad, supported every step of the way from local consultations to post-recovery reintegration. Speaking at the launch, Managing Director Albina Santange Augustine addressed the importance of India as a primary healthcare destination.
India. Why India? Someone once asked me. After all, it's so far away. India stands at the forefront of modern healthcare, offering internationally accredited JCI hospitals, state-of-the-art technology, a track record of success for cardiology, orthopedics, gynecology. The list is endless. They do all this at a fraction of the cost and about 70% cheaper in some cases compared to the United States, the United Kingdom, or Martinique.
Highlighting the patient preparation process, physician and global health advocate Dr. Timothy Asdor emphasized Orbital Well's commitment to tailored healthcare.
What that means is you may have a clinical exam, you may have us review some of your historical files, we'll possibly have to go ahead and compile some of your labs, any x-rays or reports or anything of that sort. And the reason why we do this is to ensure that you are receiving the service that you need and that you're a suitable candidate for whatever procedure that you've chosen. We've also decided to do this so that we could ensure that there's quality control of our process.
From a global health perspective, consultant and emergency medicine and trauma director Dr. Adibole Adesina noted the inequities that inspired the rise of medical tourism.
Problem was that patients from less privileged backgrounds are not able to access those care. Sometimes because they can afford the care, other times might just be political, they can't get visas and things like that. So that's how the idea of global healthcare started. Because imagine these patients that can't get this healthcare, but they are aware that there are other options that they can access, but they can't access them. So they are condemned to a life of difficulty, quality of life drops, and a lot of time they are depressed, and it wasn't very nice then. So these global health or medical tourism developed organically because there was a need for it.
Placing the initiative in the broader national health strategy, Minister for Health, Wellness and Elderly Affairs, the Honorable Bosie Jean-Baptiste, reaffirmed the government's direction.
We also know that for many decades, various policy directives have spoken to the introduction of universal health coverage. We know too that there are several studies, several attempts to introduce universal health coverage in St. Lucia. But we have decided as a government that we would introduce universal services which would lead us to a complete universal health coverage system in St. Lucia. We will introduce services as we go along while we work out a financing model for universal health coverage. And this ties into what Orbital Well will do or will continue to do.
With its guided principle of candor beyond borders, Orbital Well has positioned itself as a gateway to the world's finest medical institutions, ensuring every St. Lucian has the opportunity to pursue hope, healing, and health without borders. For more information, visit our website at www.orbitalwell.com or email us at inquiries@orbitalwell.com.